Imagine getting vaccinated against a disease, only to find out you're still at risk. That's the unsettling reality some individuals face with hepatitis A, even after full vaccination. But don't panic just yet. A recent study sheds light on just how rare these breakthrough infections are, and who's most vulnerable. According to a new study published in the December 2025 edition of the International Journal of Infectious Diseases, Hepatitis A, HepA, breakthrough infections following complete vaccination are uncommon. However, and this is crucial, they appear to be more prevalent in individuals with compromised immune systems, ICPs. This research, originating from Vax Before Travel News in Austin, meticulously analyzed data spanning from 1991 to 2024 to understand the occurrence of HepA infections in previously vaccinated individuals. The researchers sifted through a massive 3,345 reports, ultimately focusing on 90 that provided detailed information. These reports encompass a total of 43,861 HepA cases, of which 832 individuals had received at least one dose of the vaccine. But here's where it gets controversial. While 832 individuals had received at least one dose, only a tiny fraction experienced confirmed breakthrough infections after completing the full vaccination series. The study identified only 6 confirmed cases of breakthrough infections where individuals had documented proof of complete vaccination. That's just 6.4%, with a 95% confidence interval of 2.6 to 14.3%. And significantly, 4 of these 6 individuals, 67%, were immunocompromised. This reinforces the idea that a weakened immune system can hinder the vaccine's effectiveness. Further analysis revealed that among these 6 breakthrough cases, post-vaccination serology, blood tests to check for antibodies, was available for 3 individuals. 2 HIV-positive patients showed no detectable antibodies, indicating the vaccine hadn't triggered an adequate immune response. The 3rd patient, who had neutropenic leukemia, tested positive for antibodies, but experienced only mild symptoms. And this is the part most people miss. Even with detectable antibodies, the immune response in immunocompromised individuals might not be robust enough to completely prevent infection, although it may lessen the severity. The study also highlighted that immunocompromised individuals represent a notable proportion of overall HepA cases. The pooled proportion of ICPs among confirmed HepA cases was 17.8%, 95% confidence interval 7.7 to 35.9%. This underscores the importance of targeted prevention strategies for this vulnerable group. The research team emphasized a proactive approach, stating, whenever possible, vaccination should be completed before the age of 40 and before immunosuppression. This recommendation aligns with the World Health Organization's (WHO) guidelines, which advocate for a 2-dose HepA vaccination schedule for adults over 40 and immunocompromised individuals. The WHO's rationale is that there's insufficient evidence to guarantee adequate immunity with a single dose in these populations. Think of it like this: a single coat of paint might not protect your house as well as 2 coats, especially in harsh weather. So, how does hepatitis A spread in the first place? The US CDC explains that HepA is transmitted when someone ingests the virus, even in minuscule amounts. This typically occurs through person-to-person contact or through contaminated food or beverages. Unfortunately, HepA outbreaks have been a recurring issue in the United States in recent years, highlighting the continued risk. Europe has also seen its share of outbreaks in 2025, with several countries reporting clusters involving closely related strains of the virus. The CDC unequivocally states that the best way to prevent hepatitis A is through vaccination. To achieve full protection, it's crucial to receive all the recommended doses in the vaccine series. HepA vaccines are readily available at clinics and community pharmacies across the U.S. as of November 20, 2025. Here's a thought-provoking question: Given the study's findings, should immunocompromised individuals receive additional booster shots of the HepA vaccine, or should alternative preventative measures be prioritized? What do you think? Share your opinions and experiences in the comments below.